Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief in Houston, Texas. And we have Richard here this afternoon who was rear-ended on the freeway here, which we have a lot of freeways. And then the person that hit him ran off, so he had to chase the person that actually hit him to find out who hit him. But now he's had a cervical thoracic spine injury from a hyperextension, hyperflexion, or acceleration, deceleration type of injury. And that's what we're treating on him. So the first thing we're going to do is check his posture. And he's already had about 5 treatments since the accident, so he's already feeling a little bit better. But let's go ahead and go forward and backwards for me there, Richard. Now see, he's already a good pro at this. He's got pretty good range of motion, but you notice his head's still a little bit in a forward head posture with the shoulders rounding a little bit forward. He's translated a little bit to the left on the x-axis. His right shoulder is a little higher. And his pelvis is translated to the right on the x-axis as well, with a little rotation in there. And I think that's probably because he had his head turned at the time of impact. But Richard, let's go ahead and lay down here and decompress you first on the y-axis. And if you notice, most all of our patients are pretty tuned into knowing what to do with this, because I utilize this spinal decompression on the y-axis a lot because we're all compressed. Gravity's pulling us down 24/7. Whether you're standing all day or sitting all day, it's compressing you. And this is a major relief for compression type of problems, including pinched nerves. There we go. Get his legs up parallel with the floor. That relaxes his lumbosacral muscles all the way up to his skull. And we attach this towel to the base of his skull and his chin. Take a deep breath in. Let it all out and just relax. Excellent. Now that was a very smooth pull all the way through, wasn't it, Richard?
Yes.
Feel that all the way down? And see, he's got great reflexes down there. Feels good, huh? That's the way I react when I get done. Which, we were just on vacation in the Bahamas recently, and I was trying to keep up with my 17-year-old son and went parasailing and hit a big wind and it jerked my left shoulder and neck out, and I re-herniated the C6 disc. So that's why you see these pads on me right now. I'm wearing a tinge in it right now. Let's come over here. And I'm getting this exact same treatment every day in my office now too, from another Houston chiropractor who I taught how to do this. So he comes over and adjusts me and I adjust him, and then we're all happy. Legs are even at this point. That's a good start. And they stay even, but that still tightens up a little bit, doesn't it, Richard?
Yeah.
A little back here. So his pelvis is out right down here in his left sacroiliac, the right sacroiliac, and the sacrum in the middle here. L5, straight superior Z-axis here, and then you notice the arm changes angles as I move up. And we get all the way up to L1, changes, and then into T12, and there we go. Excellent. Yeah, I'm going to put your head down a little bit on this one. There we go. This just opens the joints up a little bit more. Yep. Excellent. Good job. Yep. Sometimes I'll come back down and redo those a little bit so that we can get the maximum range of motion into those joints. It resets the joints and proprioception. This is our human meat tenderizer. You all know the turbometer. Hard to figure out what people are stored and get motion, including myself. I get the old white knuckle syndrome and moving and kicking my legs whenever I get this done on my calves and hamstrings as well. Then we usually do this more deeper vibratory percussion to improve the blood supply and increase oxygenation into the tissues, which promotes healing, especially up here in his cervical thoracic spine where the majority of his injury was. And again, all the way down the right paraspinals, up the left paraspinals. Get the entire shoulder, girdle area. Got a good lumbar curve you can see right there. Excellent. Very good. Okay, Richard, let's have you set up and face towards your knee there for me, if you would, please, sir. There we go. See how he gets up good and sideways? He knows how to do all that. He pays attention. He does his home exercises and watches his posture. And he's getting well quicker as a result of that. Any of you that's been involved in a rear end type of an accident and have sustained a whiplash injury know what we're talking about. They're very painful injuries because they microscopically tear and stretch muscles and ligaments. Ligaments heal with a fibrotic scar tissue formation as opposed to normal uninjured tissue of ligament. So it's permanently less elastic. It's permanently lost some of its range of motion. And it's also permanently more sensitive because it has more neural fibrils that go in and attach to the scar tissue. So we adjust everything from shoulders and relax that wrist. Elbows, wrists, all the way down into the digits. Excellent. Very good. Okay, now let's come over here and shoot you. And the very last thing we do, of course, is a neuromuscular re-education technique where we adjust the atlas in a mirror image of the patient's current configuration. So let's go ahead and go forward and backwards again, please, Richard. Now see, the range of motion's already improved from what we've done. A little bit forward, but not as bad. So let's have you pull up here, hold there, flare these like this. Now that tightens up this whole lower cervical area. And then we pull him straight back in the Z-axis and rotate him on the X-axis into extension, which helps to put the cervical curve back in a forward lordosis. And relax. Now, when you do it this time, tell us if you feel a little easier. See, he's got
nice and smooth.
Good full range of motion, nice and smooth. Richard, would you suggest anybody that's had a car accident come see us?
Yes, I would suggest you come and see Dr. Johnson. He is the greatest. Lifesaver. Thank you.
Thank you very much. God bless you. Thank you for letting us video you today and appreciate you sharing.
No
This
problem.
is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.